We're going to be doing a video on anesthesia, and I have the honor of having Dr. Rick Spaulding with me, who's a board-certified anesthesiologist. I'm finding that patients are just as afraid of the anesthesia as they are of the procedure itself, of the treatment itself. And one of the strong points of the program that we have is that we use anesthesia in an effort to allow the patients to get through their vaginismus.
People say, what is the purpose of the intent of an anesthesiologist? In a nutshell, it's to take away people's pain and fear, and that, I think, is a blessing for us to be able to do that as a career path. We also want our patients to be safe and comfortable, but by the same token, my job also revolves around giving the surgeon, in this case Dr. Pacik, good working conditions.
And from the time they come into the operating room, what kind of safety measures can my patients count on in terms of the monitors that we use? Could you explain that a little bit?
I'd be happy to. Standards of care call for monitoring patients' heart rate, patients' oxygenation, usually done with a pulse oximeter, and we're talking a simple device that squirts red light across a finger, similar to when you were a young kid and you held a flashlight up to your hand. We also have a non-invasive blood pressure cuff that we have on the patient. And we're also sitting right there, physically looking at them, listening to them breathe, in addition to monitoring all these parameters.
And we also have then the added safety measure that all of the doctors down there, including myself and yourself, were all advanced cardiac life support certified. And we also have the safety device that the Surgery Center has been in continuous certification since 1985.
I gave my first anesthetic 30 years ago, and the changes in the tools in that 30 years has just been remarkable, and it's absolutely wonderful for our patients that we have the present generation of tools available to us. We use Versed, otherwise called midazolam. It's very specific against anxiety. It's a wonderful medication. It doesn't burn in the veins. It does not last all day, and it works very specific to take people's fear and anxiety away. People have a concern, am I going to lose control? Am I going to be out of control? Well, when your anxiety is trying to take control of you, you are less in control. And a number of patients remark on the fact that when we take their anxiety off the table, how much more empowered they are.
I think that's absolutely critical and important what you're saying, because the very first thing that happens is we need the patient in the operating room where I can get them into stirrups, where I can do an external examination, and then I like to do a very light finger examination so that I can tell where the spasm is. When we have a patient who's really nervous, we don't even show them the stirrups that they're going to go into, because just the sight of the stirrups makes them nervous. Other patients we're able to put into the stirrups so that I can do a light external examination, and that is a little bit where you begin titrating now the intravenous Versed, because I know you normally give about 2 milligrams of the Versed, and then what do you do next?
I've identified the patients preoperatively, the anxiety component, the pain component, and then the delivery of the care component. So we've even communicated with folks beforehand. Do you think you might be able to go in the stirrups, or have you ever been able to successfully do so? I found it to be very, very efficacious for us, after we've taken the anxiety off the table, for us then to come after pain. I do not want to mask or blunt the ability of Dr. Pacik to be able to determine precisely where the pathology resides. I want him to be able to be very accurate in his delivery of care. But by the same token, I've promised this patient that they're not going to be afraid, they're not going to be in pain. Right. And so what I usually come at next is the fentanyl, which is a synthetic narcotic. It's very, very clean. Again, it's very short acting, and we don't have to wait for it to kick in. We take advantage of human nature in many of the things that we do. And the way I explain this to a lot of folks is, think of the worst teacher you ever had. You know, what made that teacher the worst teacher? Usually they were incredibly boring. And as a
I think we can all think of a few.
Yes. And as a factor of human nature, nothing happened that raised your attention function, to the point where your brain decide this is worth putting into long-term memory. Everybody's had a near car accident. You can describe 15 seconds of your life in 5 minutes of detail. It's burned into your brain, and we're wired that way so we can learn life lessons and then be able to employ them for our safety in the future.
My patients walk into the operating room and they lie down, and Dr. Spaulding talks to them, and I talk to them, and the nurses talk to them. And then I talk to them later after the procedure's over, and I say, what do you remember? And they say, I don't even remember walking into the operating room. And this is exactly why I love working with you, because the medication is titrated, and that means that it's dripped in slowly, and you're watching the response, and you're watching the blood pressure, and you're watching the pulse, and you're watching how they're reacting, and you're talking to them. And it always just seems to be a perfect delivery in terms of what they need.
And this is where the communication side is so important in making this work very, very well. You know, I know that you've done your assessment. I know you've done recon. You know where you have to treat. Now, it's my responsibility, again, keeping the patient safe and comfortable, but to render the field optimized for Dr. Pacik by letting that person go off to sleep. And it's not uncommon for us to actually hear our patients gently snore because they're that deep.
Some of my patients actually continue to show some retreat behavior even with higher doses of anesthetic.
This also highlights the pathology that's being dealt with here. Because if this was all in somebody's head, when that head is asleep, when they're snoring, those symptoms should disappear.
Right.
But these are people that are snoring and there's still withdrawal. That reflex arc is still in place.
The patients now had all of this medication on board. The patient is asleep, as you say, sometimes snoring. We never hear any good stories. Everybody's worried about, are they going to release any stories? But we don't hear any good stories. We just hear a little snoring once in a while. So what's next then?
Again, since we're using very, very short acting agents and we're titrating to effect, you'll tell me I'm 5 minutes from done. I'm 3 minutes from done.
Yes.
Communication.
Yes.
So now I can further get ready to taper my stuff off. Our history is very shortly upon completion of the procedure, our folks are regaining consciousness to the level where they can move themselves, position themselves. We have them slide across to a stretcher. We then head back to our recovery room area where again they're going to be monitored and watched on a one-on-one basis. Well, there's a couple themes that are quite common among our vaginismus patients, such as, I didn't even know you guys started. Or, as you mentioned earlier, I don't remember entering the room.
Right.
And for any of the folks that are watching this at home, I don't know how many times I see it written or hear it mentioned by a patient that suffers from these circumstances to say, I just want to be like everybody else. They have sisters, they have friends that have told them, oh my gosh, this is the nature of a relationship that they can enjoy with intimacy, looking forward to children, some of these other things. And for this population, those events and those fulfillments are not attainable until something's been done about what's in the way.
Mm-hmm. Right. I think that waking up with the large dilator in the recovery room is monumental. In the recovery room, again, we keep going back to these safety issues. We have a registered nurse who's advanced cardiac life support certified. Every layer, every single thing that we do deals with the treatment, the effectiveness of the treatment, and the safety of the patient. I mean, that is absolutely paramount. And as a result of that, we have not had any major complications in the operating room. I mean, ever.
Another thing that I tell our folks is the healing starts now. That's as soon as they've gotten here, as soon as they've made that decision to travel wherever they came from, to come to grips with this thing that's impacting their life. Now it's our turn. Now,
right.
For our training, our expertise, to come at the problem that they have and try to remove it.
Great. Thank you very much for coming down, Rick.
Thank you for this opportunity for us to get the word out on how we do what I think we do very well as a team.
Yeah, let the patients know.